EHP, is one of the more severe diseases in shrimp hepatopancreas among all the Penaeus Vaname diseases. EHP proliferate extensively in the digestive organs of shrimp, absorbing nutrients, thereby affecting the normal digestive and absorption functions of the hepatopancreas and intestines, hindering the growth and development of shrimp, and in severe cases, causing their growth to stop. Poor bait efficiency and low commercial value of adult shrimp result in economic losses. At the same time, shrimp infected with EHP may experience a decrease in immune function, making the body more susceptible to invasion by bacteria, viruses, and other microorganisms, leading to secondary infections, such as WFS and Vibrio diseases. In case of stress, such as abnormal weather and sudden changes in water quality, it can cause a large number of deaths. How to prevent and control shrimp EHP effectively? EHP infection can be horizontally or vertically transmitted in shrimp. That is, shrimp can be infected through oral ingestion of infected shrimp feed, such as sandworms, copepods, rotifers, brine worms, etc., or spores in the environment, or transmitted to offspring through parent shrimp. It reproduces within host cells, is excreted through feces, and forms spores in aquatic environments. They are scattered in water or attached to algae, debris, feed surfaces, and sediment environment. Spores can accumulate and spread in aquaculture environments. The lower the breeding density, the lower the probability of EHP infection. The probability of EHP infection in high salinity farmed shrimp increases compared to low salinity. The more organic matter in the pond, the higher the risk of disease, which may be related to the host living environment of Microsporidia. The number of spores is directly proportional to the number of breeding days. The longer the breeding days, the more spores there are, especially around 40 days of breeding, where there will be a peak outbreak period. Generally, infection with EHP is not very serious, and the mortality rate of shrimp is not significantly different from that of normal shrimp. After infection with EHP, shrimp grows slowly, resulting in reduced feeding or slow growth after feeding. There is a significant difference in specifications, with an increase in FCR. In severe cases, intestinal inflammation, atrophy, and softening of the hepatopancreas, slow movement, and some shrimp may also catch WFS. Treatment of EHP. The spore wall of EHP is thick, up to 10 nanometers, and mature spores have a tough chitin shell. Generally, drugs are difficult to enter the parasite body. Currently, no definite and effective treatment drugs or measures have been found for this disease, and prevention and control can only be carried out based on its epidemic characteristics. Clearing the pond and eliminating spores. For areas with high incidence rate of EHP and ponds with slow shrimp growth, thorough cleaning and disinfection should be carried out, such as plowing the bottom of the pond about 10 centimeters deep. Use quicklime of 400 kilograms, 0.164 acres or more, to thoroughly clear the sediment so that the pH value of the pond bottom reaches 12 and remains for a period of time. Disinfection of water sources, tools, and baits. Daily breeding and production equipments must be strictly disinfected with disinfectants such as bleach and potassium permanganate before use. When feeding live baits such as sandworms, brine worms, and artemia, it is recommended to undergo freezing, pasteurization, or X-ray disinfection before use to avoid feeding on feed organisms that carry pathogens. Strengthen quarantine. EHP can spread vertically, so strict quarantine of parent shrimp and seeds are necessary. Sometimes it is difficult to detect during the seed stage. Usually after 40 days of breeding, if detected, it can be discharged to avoid causing greater losses. Enhance immunity. During the breeding period, it is recommended to feed high-level shrimp formula feed, non-high protein feed, with balanced nutrition, and mix feed with health products that strengthen the hepatopancreas to enhance the shrimp's disease resistance. Thai farmers use a combination of bile acids, multivitamins, and plant essential oils to prevent the outbreak of EHP. They repair damaged liver and pancreatic cells timely and restore the normal growth rate of shrimp, which has a good effect. Control other factors. Reduce aquaculture density and water salinity, frequent water regulation and bottom improvement, as well as reducing organic matter in ponds, have a certain preventive and control effect. Safe and efficient plant essential oil can be used for daily prevention. In addition, timely cleaning up diseased and dead shrimp is crucial for preventing the further expansion of the transmission range of EHP.